Hi, my name is Angela Corinth, and today we're going to talk about diabetes. Do you know anyone that uses these? These are insulin injectors. It helps stabilize your sugar levels. Or have you ever seen this? This is a lancing device, which is used to check your glucose levels. Today I will explain to you the most common types of diabetes. Type 1 diabetes, which is the most common form of diabetes in children, and type 2 diabetes, which is the most common in adults. I will also explain the diagnosis, the warning signs, cures to the disease, and treatments. First, I will start with type 1 diabetes, which is commonly found in children. In type 1 diabetes, the beta cells in the pancreas are being attacked by their body's own cells and therefore cannot produce insulin to take sugar out of the bloodstream. That means insulin is not produced, which is needed to convert glucose, which some of you may call glucose sugar. There are several warning signs for type 1 diabetes. You can experience dizziness, fatigue, blurred vision, weight loss, and even increased thirst and urination. It also makes up 5 to 10% of the 171 million of people affected by diabetes. Type 1 diabetes is not preventable. Changing your lifestyle or eating habits will not have an impact. So it doesn't matter if you are fat, thin, fit, or unfit, no difference to the patient's risk of developing type 1 diabetes. It cannot be reversed by doing lots of exercise. Type 1 diabetes patients have lost their beta cells. The beta cells are in the pancreas that produce insulin. There is no cure for type 1 diabetes, but there are treatments. Type 1 diabetes patients can have insulin injections, have a dietary plan, regular checkup of blood sugar, exercise daily, and treat their individual nutritional needs. Next, I will explain to you type 2 diabetes. It is the most common form of diabetes in adults. In type 2 diabetes, the body doesn't generate their insulin, or the cells do not take into account the insulin, which is also called insulin resistance. When there isn't enough insulin, or the insulin is not used as it should be, glucose cannot get into the body's cell. If glucose builds up in the blood instead of going into the cells, the body cells are not able to function properly. There are other problems associated with the buildup of glucose in the blood. It can cause body damage, like nerve damage, loss of weight, loss of eyesight, kidney failure. You can have heart attacks, or it can cause amputation to the foot. It also causes dehydration. When the glucose builds up in the blood, it causes an increase in urination, which also causes you to lose water and become dehydrated. Lastly, you can go into diabetic coma. People who are high risk for developing type 2 diabetes are the following people: people over 44, people who are obese or overweight, people who have gestational diabetes, or if you have family members who have been diagnosed with type 2 diabetes. If you have prediabetes or even high blood pressure or cholesterol, just to name a few. Type 2 diabetes has the same warning signs as type 1: dizziness, fatigue, blurred vision, weight loss, and even increased thirst and urination. With type 2 diabetes, you have slow wound healing. Type 2 diabetes makes up 90% to 95% of total cases of people affected. In type 2 diabetes, it can be prevented and even delayed with a healthy lifestyle. Type 2 diabetes can be prevented and treated. A patient can diet, exercise, lose weight, take their medications, and sometimes even insulin injections can be prescribed. In conclusion, type 1 1 and type 2 diabetes increase a person's risk for serious complications. Patients should continue to monitor and manage their disease so it doesn't cause serious complications. Diabetes remains a leading cause of blindness, kidney failure, and a list of other things in the U.S. It also continues to be a critical risk factor for heart disease, stroke, foot or leg amputation. So we must live a healthy lifestyle. We must eat right, increase our physical activities, maintain a healthy weight so we can live longer and reduce the risk of more people being diagnosed with diabetes. For more information on diabetes, go to the American Diabetes Association at www.diabetes.org.